I'm Dr. Tom Lawrence from the Division of Plastic and Reconstructive Surgery at the University of Iowa Hospitals. I'm going to talk to you a little bit today about what the role of the plastic surgeon is in the management of the patient who has undergone a nipple-sparing mastectomy. The role of a plastic surgeon in general in the management of breast cancer patients is to replace skin and breast tissue removed during the course of the mastectomy and to reconstruct as natural a form as possible. All that I need to do as a plastic surgeon is replace the breast tissue itself. This can be done either with the patient's own tissue, utilizing a flap that can be transferred from another portion of the body, or more commonly with a breast implant. I enter the operating room after the general surgeon or surgical oncologist has completed their mastectomy, and what I see on the patient's chest is the pectoralis major muscle. What I do then is elevate that off of the chest wall, and then underneath that I position an acellular dermal matrix material to create an envelope under which I can then position a breast implant. The breast implants which we most commonly utilize are these silicone gel-filled implants, which is of the same volume as the tissue that we have removed from the breast during the surgical procedure. Implants themselves are filled with a silicone gel material which has a consistency similar to that of natural breast tissue. Alternatively, we can get similar implants which are filled with a saline material. If the patient should choose to have larger breasts than they had previously, we may want to resort to a more traditional surgical approach which would involve tissue expansion. There is a port which allows us to expand the device after it is placed, and so that we can generate a larger skin envelope to accommodate a larger breast implant if that's what the patient would prefer. This does require a period of expansion and additional surgical procedure, however. We can generate, in many cases, a breast which looks very similar to that which the patient had prior to the surgical treatment of their cancer. It is not available certainly at all institutions, but it is currently available here at the University of Iowa. It is not appropriate for all patients with breast cancer, either because of the nature of their disease or because of the nature of their breasts. It's something that we would need to individually evaluate you for, and we would be happy to do that at the University of Iowa if you would like to come for a consultation.